Morning headache is quite common condition. It affects around 15% of population. And let's say, what is the most common cause of morning headache? It's tension headache. Tension headache is most common type of headache, and it's responsible around 85% of all headaches. Even morning headache is not specific for tension headache, but it's so common that in most cases it's still tension headache. Probability is around 40%. What is symptoms of tension headache? It's tight bend around the head. It's important. It's not pulsating pain, it's like tight bend around the head, dull pain and constant aching pain, and tightness in the neck and shoulders. Persons usually describe this tightness, and this tightness extends to neck and shoulders. It's tension headache. And what is the cause? Cause is poor sleep posture. It's important. It causes strain of muscles, anxiety, which can cause clenching of muscles, and dehydration or caffeine withdrawal. All this above mentioned causes tension headache. Treatment: usually tension headache responds on conventional treatments like ibuprofen or aspirin or acetaminophen. They are non-steroidal anti-inflammatory drugs. Second most common cause of morning headache is migraine. Migraine is important. It affects around 10% of world population. That's why it's important. And characteristic of migraine is throbbing and pulsating pain. So if there is band-like sensation which extends on neck and shoulders, it's tension headache. But if there is throbbing or rhythmic or pulsating type headache, it's migraine. Migraine usually affects one side of the head and also associated with other symptoms like nausea, sensitivity to light, sensitivity to noise and sound, and it lasts for several hours and sometimes even days, while tension headache will disappear soon, maybe after 30 minutes, maybe after 2 hours. But in case of migraine usually lasts and longer. Migraine can be triggered by lack of sleep, certain foods, and withdrawal from caffeine. So different things and different factors can trigger migraine. And what is treatment? Treatment is triptans, first line treatment of migraine, like sumatriptan, and non-steroidals also like ibuprofen. Third most common cause of morning headache is sleep apnea. The probability of sleep apnea is 15%. And if we describe what is sleep apnea headache, it's usually dull, constant ache and felt of both sides. It looks like tension headache. And idea of sleep apnea is interrupted breathing patterns. When during the sleep our airways is obstructed temporarily and it causes breathing interrupts. And headache pain usually disappears after 30 minutes, maybe in 1 hour. Also associated symptoms include fatigue, loud snoring, observed episodes of stop breathing during sleep, difficulty concentrating during the day, and irritability. And usually sleep apnea is associated with obesity and overweight. Weight loss is important, avoiding alcohol and sedatives because they can relax our muscle and it can worsen sleep apnea, and continuous positive airway pressure therapy if needed. Also, another cause can be dehydration, 10% probability. Dehydration, especially if there is summer and person is physically active, very common. So dehydration can cause headache, and adequate fluid intake is solution. And brain tumor. Brain tumor is very unlikely, especially if person is generally healthy. but it has less than 2% probability, but we should not we should pay attention to exclude this also. And what type of pain it is? It's dull, continuous ache, more pressure-like or constant weight in the head, and it's worsen over time. It worse during coughing, during sneezing, during bend over. It usually does not respond well on medication. Pain worsens when person lying down. Headache is persistent, worsening over time, can be accompanied by neurological symptoms such as vision changes, speech difficulties. Actually, it needs urgent medical treatment and medical attention at least. That's why we should pay attention to these red flags, like continuous pain which progresses over time. Other headaches usually stable over time, they does not increase and does not progress, but when there is tumor, this pain worsens over time and it persists. During start, it can start as a morning pain, but then continues to whole day pain and not respond well on medications. It's also important point. That's all I wanted to say about morning headaches. Thank you for your interest. Thank you for your watching. If you like my videos, please thumbs up. If you like my channel, please subscribe. Thank you very much. Bye for now.